When I first saw anti-CCP on my lab results back in 2017, I felt a pit in my stomach. I didn't know what it meant, only that the number was high. Understanding your lab work is the first step to taking control of your health. Today, I want to explain exactly what are anti-CCP antibodies, why they are the most specific marker we have for rheumatoid arthritis, and what your numbers actually mean. Think of your immune system as a security team. Usually it protects you, but with rheumatoid arthritis, it gets confused. Anti-CCP stands for anti-cyclic citrullinated peptide. These specific antibodies mistake normal proteins in your joints for invaders, because a chemical change called citrullination alters their shape, turning your immune system against your own tissue. Anti-CCP is incredibly informative because of its specificity. While a test like Rheumatoid Factor can sometimes give a false positive or be negative, like it was for me, anti-CCP is correct in diagnosing RA about 95% of the time. In my case, this was the test that finally gave me a clear answer. What many people don't realize is that these antibodies can actually appear in your blood up to a decade before your first flare. If you've caught this early, you have a massive head start in protecting your joints. Now, before we look at how to test for these, a quick reminder. I'm sharing this as a patient who has walked this path, not as a professional. You should always consult your rheumatologist to read your specific lab results and explain what they mean for your unique case. The test itself is a simple blood draw. You don't need to fast or do anything special. And it doesn't only show if you have the condition, but how active it is right now. While every lab is a little different, here is a general reference for what those levels mean. Anything under 20 units per milliliter is generally considered negative. A result between 20 and 39 is a weak positive. This could indicate very early RA or perhaps low-level disease activity. Once you hit the 40 to 59 range, it's a moderate positive and a strong indicator for rheumatoid arthritis. And anything over 60 units per milliliter is a strong positive. This shows a very high specificity for RA and sometimes suggests a more aggressive progression that needs proactive management. When I got my results, I had to learn that the number isn't a life sentence, it's a data point. High anti-CCP levels predict more erosive disease progression and help doctors choose aggressive early treatment. I know how overwhelming these numbers can feel, but remember, the lab report is just paper. You are the one in the driver's seat. Use this information to ask better questions and build a plan that works for you. If you're newly diagnosed or just trying to decode your body, I'm here. Hit subscribe for more content, and let's keep moving forward together.